What is the difference between pre-diabetes, diabetes, insulin resistance? Before we'll answer that question, let's talk about one of the main functions of insulin. Insulin is a key that opens receptor on our cells that allows glucose to get inside of the cells. If the cell gets a lot of glucose, it will modify those receptors, so it will not get all the influx of the glucose and basically will downregulate those receptors, and those cells will become very insulin resistant. Well, because the body still senses that there is a lot of glucose floating around in the blood, it will produce more insulin. So on initial stages, patients will have higher glucose and higher insulin. As this thing progresses, your glucose will get higher and higher and higher, and your insulin will get higher and higher and higher, and you will develop a so-called pre-diabetes. That is the stage when A1C, which is a cumulative number of glucose in our blood over the last 3 months, will be above 5.5 and below 6.4. And as the time progresses, your pancreas will become less functional, it will produce less insulin, but your glucose will remain much higher, and then you actually will develop diabetes, which is by criteria, everything above, with the A1C above 6.4 or 6.5. So, in reality, this is a continuation of the process. And from neurological standpoint, unfortunately, you can get the same damage that you will develop during diabetes in the pre-diabetes stages. I've seen a number of patients who develop strokes with pre-diabetes. I have numerous patients who develop neuropathy in the stages with the pre-diabetes. So even though we will say, well, they don't have diabetes, so they should not have those complications, in reality they do, because it's a continuously process. And it depends on a lot of different factors, a lot on your nutrition, on your lifestyle, on amount of stress, but also on how much deficiencies you have in your body. So it's a very complex process, and just saying, well, eat vegetarian diet and don't eat at all carbohydrates and go on carnivore diet may not be necessarily accurate, because some patients require much more. They will require specific nutritional support. They will require a lot of lifestyle interventions and certainly emotional interventions. Follow me for more. We'll be talking more about insulin resistance and diabetes. And ask me questions.